In the interest of time, we'll move on ahead to the next speaker, and it's our pleasure to invite Dr. Mark PENNESI from the United States to talk to us about optoretinography, inherited retinal diseases, and we'll take questions for both talks if required at the end.
Thank you. It's really a pleasure to be here. So in the previous talks, we heard the importance of measuring function in the macula for diseases such as AMD, as well as inherited retinal degenerations. But this is actually difficult because if you look at tests such as microperimetry, they're subjective, they're quite variable. Tests like multifocal ERG, while being objective, have a low resolution. So I'm going to talk about a new technology that provides both objective outcome measures as well as high resolution, and this is the ORG. Here are my disclosures. I'd like to acknowledge all of my co-authors, in particular Siyu Chen, who is really the brains of all of this. So if we look at individual photoreceptors using adaptive optics, you can see that there's a change in the reflectance when they're exposed to light. On the right-hand side, you can see these individual photoreceptors scintillating. And this results from a very interesting phenomenon that happens when light strikes the photoreceptor. So there are actually changes in the length of the outer segment, as well as changes in the light scattering. So initially, there's a shortening of the outer segment, followed by a lengthening of the outer segment, and then a return to baseline. And so we can actually measure this, and there are different ways of doing this. One way is with AIOS2025, and if you look at individual photoreceptors, you can measure the actual change in the outer segment length. And if you look at patients with diseases such as retinitis pigmentosa, you can actually see a decrease in this change as the disease progresses. Now, not all of us have adaptive optics, and so we wanted to explore a way of actually measuring these changes just using OCT, and this is going to employ an algorithm called split spectrum amplitude decorrelation optoretinography. I'll call it ORG for short. And the idea here is that if we look at the wavefront of the light going into the retina and then measure the wavefront coming out and add these together, you will get an interference pattern. Then if you flash light and the outer segment changes length, this pattern will change. And by looking at how these two waveforms are decorrelated, we can elicit a measurement. So what we deliver to the retina is an alternating stimulus of light and dark, and then we measure the reflectance of the outer segments, and below you can see how we can actually derive an optical image of these changes that matches the stimulus. And we can show that as you increase the intensity or the amount of cones that are bleached, that this signal increases in a predictable manner. This is our protocol where we do 3 scans, each 3 by 1 millimeters, to measure the central macular function. And this is what a typical result or signal would look like. So we were interested in looking at patients with inherited retinal degenerations. We measured 39 IRD patients, or 55 eyes. And here's one example of a patient with a mild form of sector RP. And when you look at the OCT in this patient, you see it actually looks quite normal because their degeneration is in the periphery. And if we look at the ORG, it looks quite normal. In contrast, if we look at a more advanced patient with retinitis pigmentosa, you can see now there is outer retinal atrophy, but sparing in the fovea. Microperimetry shows a small area of sensitivity. And if you look at the ORG, this actually matches the microperimetry. Here's a second example of this phenomenon, also showing a decrease in the ORG signal, but some preserved signal centrally. This shows a compilation of all of the patients, and we can see that with these RP patients, there is a decrease in the mean ORG signal. And we can measure the repeatability of this both in healthy patients and in patients with disease and show that it is quite repeatable. Furthermore, we can correlate the ORG signal with microperimetry, and we see a nice correlation here. This is just an example of measuring this in some other patients with macular dystrophies. This is a patient with a mutation in CRX, which causes a cone dystrophy, and this patient, you can see, has a bullseye maculopathy. There's relatively mild decreases on the microperimetry, and you can see parafoveal atrophy. And when we measure the ORG, we can see a decrease in signal that correlates with the microperimetry, as well as retention of the signal centrally, where microperimetry is normal. Here's a second case, and this was a patient with a very mild case of ABCA4-related cone dystrophy. And if you look at the OCT, you can really only see very subtle changes, some thickening of the external limiting membrane, perhaps some shortening of the outer segments. And if you look at the microperimetry, there's only mild changes in the sensitivity. However, when we look at the ORG, there is actually quite a decrease in the parafoveal region. And it's interesting that when we look at the relationship of microperimetry versus the ORG, we see that cone dystrophies actually show more change in the ORG than the corresponding change in microperimetry as compared to patients with rod cone dystrophies. So this modality may be particularly useful in detecting early cone dysfunction. We've also started to look at patients with dry age-related macular degeneration, and this is an example showing two different patients, one where the imaging was performed in an area with large drusen, and you can see a decrease in the ORG signal. The second is a patient with subretinal drusenoid deposits, and once again, you can see a decrease in the signal there. This is work that remains to be completed, but early attempts show that this might be a promising way of measuring retinal function with AMD. So in conclusion, this delivers an objective and reliable measure of photoreceptor function in both normal and patients with IRDs, correlates very well with microperimetry, especially in patients with rod cone dystrophies, and it may detect early cone dysfunction loss even before microperimetry. Thank you very much.
Mark, thanks very much for that nice presentation. As Joe's getting up, I'm going to ask you a quick question. We know that the reflectance of the photoreceptor layers is highly dependent on the angle of incidence. And I'm wondering, in real-world clinical practice, we often get scans that are obtained slightly off the center and they're slightly tilted. Are there ways that you compensate for that or address that? Because I know you showed some reproducibility data.
Yeah.
And along that same line, in the setting of topographical diseases with significant topographical variability, like you showed the AMD case at the end, how do you manage that? Because it seemed to me that should potentially be an artifact.
Yeah, so I think it's a great question, and what we're actually trying to do is take advantage of that, right? So, Brandon Lujan has been very interested in directional OCT, so we're actually going to try to do the ORG at multiple angles and see if you can then actually look at the relative change in reflectance at different angles and utilize that information.
Joe.
Yeah, that was great, Mark. Two quick questions. What's the relative adaptation that's optimal for this in terms of dark adaptation? And then secondly, have you looked at recordings at different times of the day? I'm specifically interested in some of these patients and whether there might be any circadian differences in the response.
Yeah, we have not looked at the circadian response, but that is something on our to-do list and I think would be quite interesting. In terms of the dark adaptation, right now it's essentially a mesopic test. We're not strictly putting the patients in the dark or adapting them or light adapting them. The stimulus itself, of course, is going to bleach, some. So it's kind of hard to control that. I mean, ultimately, we do think there will be ways to actually get at a rod ORG by maybe using a red stimulus and actually doing things under dark adaptation.